Hi everyone. Today we are going to discuss about the liver cirrhosis. It is one of the important topic to discuss. Many important questions will be arising from this topic. So coming to the definition, inflammation of the liver parenchyma, irreversible damage to the liver parenchyma characterized by granular necrosis and granular scarring. So what is the liver parenchyma? Liver parenchyma refers to functional tissue of the liver, primarily composed of the hepatocytes, which are the mainly primary cells of the liver. So this is the main important functional tissue. Liver sinusoids. It is also unique specialized capillaries in the liver that facilitate the exchange of the nutrients of oxygen between the blood and liver parenchyma. Liver parenchyma is the functional tissue. It is a functional tissue of the liver where will be the hepatocytes, Kupffer cells will be seen. So what this is liver sinusoids is like capillaries which will be facilitating the oxygen nutrients exchange in the liver parenchyma. So this is the liver, healthy liver. What will happen? There will be like granules, like small granule like necrotized cells will be replacing the healthy tissue. So these are the sinusoids where will be the exchange of the blood vessels. Capillaries will be seen here, sinusoids will be seen. Hepatocytes and sinusoids. So these are the sinusoids. This is a healthy liver. So coming to the main topic, what are the different types of cirrhosis of liver? So first one is very important, alcoholic cirrhosis, also known as celiac cirrhosis. Celiac cirrhosis, most common type of this is the most common type of cirrhosis. Main common cause is chronic alcoholism. Like more heavy drinkers will be face this type of problem complication because of the alcoholism. Cirrhosis of liver will be seen. Most common cause is chronic alcoholism due to activation of ITO cells. Because of the ITO cells, this type of the chronic alcoholic cirrhosis we can see. Second one is biliary stenosis due to the obstruction of the biliary tract. Biliary tract obstruction also leads accumulation of the bile salts, ammonia, all the waste in the blood vessels. It will be affecting on the liver. It leads to the biliary cirrhosis. Next one is cardiac cirrhosis due to the right heart failure. What will happen? This systemic circulation will be disturbed. So what will happen because of it, right heart unable to pump the blood to the lungs for the purification? What will happen? This will be from right atrium, the blood backflows will be seen. So what will happen? The portal hypertension will be leading. So liver on the liver mainly the pressure will be more. So that time what will happen? Because of the right side heart failure, so cardiac cirrhosis will be seen, liver failure will be seen. Next one is post necrotic cirrhosis because of the hepatitis B, C, D, some hepatotoxic drugs. These will be leading the post necrotic cirrhosis. Because of these condition, liver cirrhosis will be seen. So coming to the pathophysiology. So chronic alcoholic cirrhosis of liver, how it will be seen? So activation of the ITO cells, severe inflammation and fibrosis will be forming. So fibrosed tissue will be replacing the healthy tissue. So what will happen? Sinusoids, this is the capillaries which will be helping to exchange of the oxygen and nutrients. Blockage of these sinusoids will be leading them congestion of the blood into the liver. So what will happen? Hepatomegaly will be seen. So swelling of liver enlargement will be seen. So that time what will happen? Anorexia and nausea will be seen. First important, most important, earliest signs and symptoms will be anorexia and nausea. So when hepatomegaly will be seen, pain at the right upper quadrant, palpable liver. If we'll be palpating at the right quadrant, we can feel the liver. Why? Because hepatomegaly, increased size of the liver will be seen. So pain also seen in the right upper quadrant. So coming to the earliest clinical feature of the liver cirrhosis is anorexia, and second one is nausea and vomiting. Then second type of blockage of the sinusoids pathophysiology, congestion of the blood vessels in the liver. Congestion of the means blood will be stagnated in the liver. What will happen? Because of the congestion of the liver, portal hypertension will be seen. So from the portal vein will be arising from the liver. So what will happen? Because of the congestion, stagnation of the blood in the liver, what will happen? Increased blood flow seen in the portal vein. So it will lead to the increased portal hypertension will be occurring. So increased hypertension, BP will be seen in the portal vein. So that time what will happen? So these will be leading this portal hypertension will be leading these consequences like esophageal varices, splenomegaly, hemorrhoids, and caput mucosal. So gastric vein, what will happen? Because of the portal vein hypertension, least gastric also, this blood congestion will be leading this pressure on the gastric vein also. That time what will happen? Esophageal varices, like hemorrhoids will be seen in inside of the blood vessels. So what will happen? Swelling will be happen. Like that only esophageal varices, inside of the esophagus, the veins will be enlarged. Sometimes it will be ruptured and bleeding will be occurred in the stomach. So total HB will be lost. Anemic patient will be become anemic. So this type of the so intestinal obstruction will be leading. So many consequences will be coming because of the gastric vein congestion. Next is splenomegaly. Splenic vein pressure on the portal vein pressure, it will lead on the splenic vein also. So that time splenomegaly will be seen. Inferior mesenteric vein, so it will lead to hemorrhoids. Periumbilical vein, caput mucosal. So what will happen? Caput mucosal, so umbilical say this is caput mucosal. So what will happen? This periumbilical blood vessels will be like varicose veins will be happening. This is important clinical feature in this liver, in this periumbilical vein. And the congestion because of the periumbilical vein, caput mucosal will be happening. Most common complication of the liver cirrhosis is esophageal varices. So esophageal varices, bleeding will be seen. Patient under stomach will be like bulged with blood. So melena will be seen. Melena fully smell. When will be patient will be defecated, we can experience very foul smell feces from the patient. So causes of the esophageal varices, hemorrhoids, etc. in liver cirrhosis is because of the portal hypertension. Splenomegaly plus hepatomegaly, we can, so these are the like questions will be coming in this question. So liver cirrhosis, hepatomegaly, if patient is feeling hepatomegaly or splenomegaly, this will lead to liver cirrhosis. Capillary mucosal, dilatation visible daughter of the periumbilical vein. We already see in the picture. So next is blood in the nasogastric aspiration of the liver cirrhosis. Client indicate that In this fever, because of the patient unable to take the food because of the anorexia and vomiting, patient unable to take the food also, that time we will be for gastric aspiration we will be introducing the nastrogastric tube. That time we can see the blood in the nastrogastric tube. So nastrogastric tube, inside this, when we will be aspirating blood, we can see in the liver, esophageal varices patient. So when we will be observing the feces test, we can see bowel occult blood test, stool blood test we will be doing. So blood also is seen in the stool. So these indicate the hemorrhoids. Some patient will be feeling fresh blood will be coming in the esophageal because of the esophageal varices, and like dark stool will be coming because of the hemorrhoids also. So third one is blockage of the sinusoids, non-functioning of the hepatocytes, non-proper formation of the bile, effect of the mechanism. Because of this, liver is not going to properly function. What will happen? It will be effect on the bile salts and bile pigments. What will happen in the bile salts? Bile salts is very much important to emulsification of the means digestion of the fats. Like what will be taking the food heavy, like if patient is sedentary lifestyle, patient will be heavy, excess of amount of the fats will be taken into the food. So what will happen if bile salts is not there? Fat emulsification will be not occurring. No fat digestion, absorption will. So steatorrhea will be seen. Steatorrhea means excess of the fat will be seen in the feces. No fat soluble vitamin absorption, because of the fat is not going to digest. So what will happen? Fat like fat vitamins, ADEK, in that K will be deficiency will be seen. So if K deficiency will be seen, what will happen? Bleeding disorders will be seen. So excretion of the bile salts in the urine. So excretion of the bile salts in the urine, what will happen? If we can observe the frothy and foamy urine, orange color urine, if the patient will be having the urinary bag, we can observe in the urinary bag frothy and foamy orange color urine. Because of this, the excretion, it is not this mechanism is very much disturbed. So what will happen? Bile salts, excess of bile salts will be excreting from the urine. That time we can see the frothy and foamy orange color type of urine in the urine. So bile pigments, no. So what will happen? No bile pigments in the stool. So clay colored stool will be seen because of the no pigment, excess of the bile pigment in the body. So improper functioning of the bile pigment, what will happen? We can see the patient clay color stools also we can see. So because of all the waste products accumulated in the blood, what will happen? Patient will feel the purities itching, full patient will be scratching like anything, then jaundice will be observed. So these are the because of the blockage of the sinusoids. Sinusoids are the main capillaries which will be helping of the inside of the liver. It will be helping to exchange the oxygen, nutrients, everything. So if it is will be blockaging, what will happen? These bile salts and bile pigments, excretion and mechanism, so exchange improper function leads to jaundice and purities. So next, coming to the liver cirrhosis, no proper synthesis function, altered form of the clotting factors, increased bleeding will be seen. So because of the vitamin K is not going to form, what will happen? Bleeding tendency will be increase. That time we can see petachy, pura and ecchymosis. Petachy is if we'll be seeing like dot like blood coagulation, blood clot on the skin. Petachy we will call as it will be 1 mm. Pura means 2 to 9 mm. Ecchymosis is more than 10 mm. This is very, very, very important. So this type of the skin discoloration we will be seen in the patient. liver cirrhosis. No degeneration of the estrogen. So what will happen? Improper degradation of the estrogen. What will happen to the patient? Gynecomastia, palmar erythema. Palmar erythema also we can observe in many patients. Palmar erythema also, if it is there, 100% hepatic failure will be seen. Telangiectasia, it is like a spider web, that type of small capillaries, like that we can see on the skin. So these are the main, due to the non degradation of the estrogen, this type of clinical features also we can observe. Non functioning of the Kupffer cells. What will happen? This is the Kupffer cells like macrophages. So if anything will be waste products, it will be engulfing. Because of non functioning of the Kupffer cells, not formation of the globulin, so immune suppression will be seen. So immune response, another diseases also will be occurring. Decreased heat production, because of mainly metabolic organ is liver. If it is not going to properly work, heat production also not going to happen. What will happen that time? Hypothermia and intolerance to cold will be seen. No proper hemopoiesis. So what will happen? No proper hematopoiesis also not is going to occur. So what will happen? RBC, WBC and the platelets also not going to properly form. That time pancytopenia. All three types of bloods also decreased. No formation of albumin. Decreased because of the decreased oncotic pressure. Albumin will be not there. So what will happen? Decreased oncotic pressure will be seen. So that time extravasation of the fluids come cell, from the cell, all the fluid will be coming outside of the cell. So that time we can see the generalized anemia. What we'll call as anasarca. Generalized anemia is called as anasarca. Increased pleural fluid production. What will happen inside of the pleura? The pleura fluid will be increased production of the fluid. That time pleural effusion. So breathlessness also happen. That time what will happen? Patient will be feeling the dyspnea. So we have to provide the comfortable position like a semipolar position. We have to like if patient will be feeling dyspneic, we have to provide the comfortable position by providing the semipolar position. Weight gain due to the edema, anasarca, total body edema will be seen. So patient will be seen from anywhere. Patient will like, if will be patient will be seeing pitting type of edema also we can see. Total body edema will be seen. So weight gain will be there. So we have to measure the weight also. Daily patient weight at the same time with the same scale, with the same cloth, same type of cloth, we have to measure the weight of the patient. Cirrhosis of liver patient, to maintain the input output chart, we have to check the patient weight also every day. Earliest edema we can see the periorbital edema. Around the eye we can observe the periorbital edema also we can see. Ascites, it is also occurring in the liver because of the decreased albumin. What will happen in the portal vein will from the all the vein, so fluid will be coming in the periumbilical area, and total abdomen, in the abdomen the fluid accumulation will be seen. So what will happen? Ascites also occurring in the liver cirrhosis of the patient. Due to the portal hypertension and decreased albumin, we can see the ascites patient also. It will be feeling very dyspneic patient. It will lead to patient comfortably is main important in this type of ascites patient. So complication, esophageal varices. What will happen? Esophageal varices, most severe type of bleeding will be seen in this type of patient. Pleural effusion, decreased albumin, decreased oncotic pressure will be leading the accumulation of the fluid in the pleura. So emphysema, due to deficiency of the alpha-1 antitrypsin, emphysema also we can see. Hepatorenal syndrome, renal failure also, because of the liver failure patient may go into the liver failure, renal failure also. Hepatic encephalopathy, what will happen? Because of the accumulation of the all the ammonia, urea in the blood, what will happen? Brain tissue will be damaged. That time hepatic encephalopathy also will be seen. So features like restlessness, confusion, disoriented, lethargic, altered level of consciousness will be seen in these hepatic encephalopathy patients. So restlessness, the are earliest indication of the encephalopathy. Because of this improper functioning of the liver, ammonia will not be going to excrete. So that time we have patient will be altered consciousness we can observe. Hepatic ataxia, flapping tremors will be patient. This is one of the most important clinical feature. Anyone can observe this flapping tremors also we can see. Then hepaticus, fruity smell from the fruity smell. If will be patient will be talking, we can smell from his mouth fruity smell also with seizures, hepatic coma and death. These are the main complications will be patient will be experiencing because of this liver cirrhosis. So how to identify diagnostic ultrasound? We can identify the ultrasound liver, this granular tissue necrosis, these sinusoids, congestion, everything we can observe in the ultrasound. CECT abdomen. So CECT contrast abdomen also we can observe. So liver functioning test. Total total plasma protein 7.3 grams per percentage, albumin, globulin, fibrinogen, albumin globulin ratio. This we can see in the liver function test. If it will be decreased, 100% liver damage. So serum bilirubin, increased serum bilirubin will be seen. Because of the jaundice also we can observe in this type of patients. Liver enzymes SGOT, SGPT. So it will be very increased amount. So SGOT should be 0 to 40 international units per liter. It will be increased in a level also in this severe cirrhosis. SGPT also 10 to 40 international units per liter. Serum alkaline phosphate. So it will be also increased. Most so liver confirmation test is liver biopsy. Management, what is the management this type of liver cirrhosis? Nothing per oral status. Because of patient will be esophageal varices. If you will be giving anything food, it again rupture the esophagus, again leading to the many ulcers like that. So we should not give anything per mouth. So IV fluids, colloid solutions we should because of the already patient will be feeling anasarca na. So if we'll be giving this we should administer only colloids. To decrease the anasarca we have to administer only colloid solution. IO chart we have to maintain, semipolar position we have to maintain. Then astrogalactic function, low pressure intermediate. So to know if patient will be having esophageal varices, NG tube we can see the blood also. So if we will be giving more pressure, it again will leads to esophageal rupture. So we have to with low pressure intermediate functioning, NG tube functioning should be maintained daily. Patient daily assessment for checking the edema, same scale, same timing, same type of cloths. With that we have to maintain daily weight. Abdomen girth also, to know the how much ascites development at the level of the umbilicus. With the inch tape we have to assess the abdominal girth also. The treatment, proton pump inhibitor like pantoprazole to decrease the stress induced ulcers. To decrease that, so we need to administer pantoprazole. Somatostatins like octreotide to prevent the liver function. To if increased amount of the liver functioning again, another liver markers, liver enzymes will be increased. That time what will happen, this again accumulation like protein metabolism, that everything will be happening. So that time another problems will be raised. So to decrease the liver functioning, to make the liver rest, we'll give this stomatostatins, octreotide, neomycin to for the colonic flora washout, protein fermentation, to ammonia production in no ammonia production in colon. This neomycin will do this type of function. No protein fermentation. What will happen if no protein fermentation? No ammonia will be formed. No ammonia means no wastage accumulation in the blood. No accumulation means brain encephalopathy will not happen. So neomycin will function like this. Lactose, for the to wash out this ammonia, we help the patient to defecate this easily. Will give this lactose. If edema will be, diuretics will be give, like ascites, then anasarca. This edema we need to decrease, so that we will give the diuretics. Antiemetics. Paracentesis. For paracentesis is the procedure. We'll give the small hole will be creating like dialysis peritoneal sorry, paracentesis. We will be taking out of the some amount of the fluid from the abdomen. We'll do the paracentesis also. Blood transfusion if needed. Liver transplantation, it is the lastest most of the management. Liver transplantation. So diet will be high carbohydrates, low fat, low protein diet will be given in this liver cirrhosis. So cirrhosis liver is the important topic where many important questions will be coming in this liver cirrhosis. Thank you.